Happy Thursday. Always nice to say good morning to you here on 3+U. We're smiling big this morning because we're kicking off the show with Dr. Luke Maxfield with Aspire Dermatology and Skin Surgery Center. He too excited for the fall weather that's going to finally be coming our way, but you're already seeing people coming in with some skin issues, I guess, as the weather dries out. Is that the issue?
Mm-hmm. Yeah, exactly. So today I figured I'd bring up two of the most common things people come in for during the fall. I will say also, though, I'm extremely excited for fall. This might be my favorite season in Tennessee.
Get in line.
I know the leaves haven't even changed yet, but I'm loving it outside.
Yeah.
So I just had to throw that out there because it's actually making me very happy. But yeah, we see a lot of eczema and then psoriasis this time of year.
So what's the difference between the two?
Perfect.
Eczema and psoriasis.
Yeah, that's exactly what I harp on, because both can be red and scaly, but they're actually quite different pathophysiologically. So eczema is this red, typically fairly flat rash, but itch is by far the most prominent and disruptive feature. And then you have psoriasis, which is also red, but more prominently scaly, often raised. This can affect the body and the scalp and the whole body and joints. And this one, the itch isn't as prominent. And the way I want to organize it today, I think, is in common, they have red scaliness and itchiness, but also when we talk about what we want to do with it, I'm going to prepare us in terms of maintenance, like what you can do at home, and then just briefly touch on in the office.
Okay, I don't want to waste your time, but can I ask you a quick question before you get into the treatment? Are these things, either one, eczema or psoriasis, things that can develop at any point in your life?
Yeah, they can. They kind of occur in different times. So eczema, you're born with structural defects in the skin, so it's really prominent oftentimes in infancy, even toddler years. And
so
then
it shows up earlier?
It does.
Okay.
It gets better, but then it can get worse again at some point. Psoriasis typically presents a lot later, maybe in the second decade of life.
Okay.
But both can occur anytime.
Are they considered autoimmune?
See, I love it. I was talking to a patient about this yesterday because technically no, I would say, but both of them have something in common, and that's inflammation. So your body is creating inflammation that does not need to be there for both eczema and psoriasis. It's always smoldering, always hidden underneath the skin. And so while it's not autoimmune, it is your body's immune system turned on in a way that it shouldn't be.
Okay, so because of that, it's not exactly external, it's kind of internal. Does that mean that it's really important more than ever to use the right product?
It kind of does.
Can you damage it if you're not using the right thing?
Because while external factors can trigger it, exacerbate it, make it worse, because there is always this underlying component that comes from inside of you, you have to do a lot to kind of compensate for that, whether it's your skincare products or lifestyle, to try to keep it under control.
Okay, so let's stick on the path for just a minute. So treatment, how do you like to treat eczema?
Okay, so for maintenance, this is where the over-the-counter stuff lives, what you can buy at the drugstore, what you can buy at Walmart. This is where you're going to help heal that skin barrier. So a couple of key things to look for are just your richer creams, your moisturizers that are fragrance-free. That's extremely important for people with atopic dermatitis and eczema. And then also ingredients like oat extract is a really, really good ingredient. You can get coconut oil, which is actually really well studied for eczema and atopic dermatitis, or Vaseline or petrolatum-based ointments can be really good to just lock in all that moisture and protect that skin barrier.
Okay, all right. Psoriasis, what are you doing for it?
So psoriasis over the counter, you're much more limited. I think the main active ingredient, if not the only approved active ingredient over the counter, is going to be salicylic acid. So if you get like your CeraVe psoriasis cream with salicylic acid, it'll help thin out the plaques, help soften them up. And then a hidden gem is actually coal tar, especially for scalp psoriasis. And if you have it, those thick, flaky scalp plaques, you know it's hard to get rid of.
Is any of this benefited by diet changes?
Eczema when you're a kid actually can be significantly impacted by your diet. Many people have very common allergies to things you come in contact with, whether it's oats or corn or milk or a number of things you consume on a daily basis.
Yeah.
Psoriasis much less so.
So if you're a child, if your child has this and you alter their diet and it's impacting them in childhood, as they get older, is it going to come back? Or once you've knocked it, you've kind of knocked it?
No, it typically comes back because the underlying cause is still part of you. You're kind of born with this change in your genes. And with diet too, you also for eczema will grow out of those dietary problems almost universally.
So time of year that we're talking, does the dry weather and the heat about to turn on side houses and stuff, does that add to the problem?
Absolutely, yeah, kind of like what we talked about last time. You're cold, so you turn on your heat, it makes it even more dry, and that also dries out your skin. So that's why these two conditions will see a bit flare this time of year.
Does clothing matter?
It I won't say universally, kind of those polyester blends typically play best with that type of sensitive skin or dry skin.
Because it's soft on
Yeah.
it.
It's soft, and I don't know why. I very much dislike certain clothes because they just feel like they dry out your skin.
Yeah.
But that's more of a subjective thing.
Does exercise matter? Like, does sweating add to it?
I would love to say that the more active you are, the better it will be, but it actually probably does not impact it too much. For psoriasis, the healthier you are overall, it actually does impact psoriasis.
Yeah.
But it's kind of a chicken or the egg thing. Relationship's a little bit complex.
I think I have like a minute left before I run. You mentioned over-the-counter. If those are not working, can you get prescription strength?
Yep. So over-the-counter, again, is maintenance, skin barrier, and for the two conditions. But prescription is really where the anti-inflammatory component really lives. Like you can use cortisol over-the-counter temporarily, or cortisone rather. It's okay, but it's temporary. Now, just putting this out there, for the last 10 years, the medications for eczema and psoriasis have been revolutionized, worlds more effective,
Oh,
and the
good.
safety profile has become extremely good.
Okay.
So I think for people, what I see a lot is if you had psoriasis even 10, 15 years ago and you haven't seen anybody, you might not think there's much out there, but the
there
treatment
is.
for these two conditions has been just dramatically changed.
Well, you know what? That is great news for a lot of people because it is hard to think about this being kind of a lifelong battle, and nobody wants to face that every day, so to find some help is a great thing. 2 locations still? Aspire Dermatology and Skin Surgery Center in Soddy Daisy, also in Cleveland. AspireDermatologyTN.com is the simple website to go. You can book your appointments online. Also give them a call, 423-712-9301. Thanks, Luke.
Need a moment that feels like you again? Zen Nail Spa is now open in downtown Chattanooga. Flawless nails, fast service, calm that stays with you. From quick touch-ups to full pampering, we've got you. Walk in or book online. Your moment of Zen is waiting.